Next up is Kesha Sauvageau, and she is going to help us know how to get at the resources.
You guys, I made it. Step 1, didn't trip. We're good. I'm not that tall, so all right. Can you all hear me okay? I know I could shout and everybody in here would hear me fine, but online I want to make sure they're good too. This is good information. So first off, I just want to say thank you to everybody for having us here. So I'm going to go through First Link and who we are. I know you've heard our name a couple of times, and thank you to everybody that is so supportive of us and everything that we do. My name is Kesha Sauvageau, and I'm the Community Outreach Coordinator for First Link. So that's a fancy way of saying is that I get to do a lot of presentations and meet with a lot of great people all across our state. So let me just kind of start off. I know you guys have heard us a few times in here, but how many of you guys know who First Link is? Oh my gosh, that's amazing. So, so glad that you guys do. Often when I do this, the responses are like, I don't know, or of like, I've heard of you, but I have no idea what you do. So, which is a-okay because we're a nonprofit and a lot of what we do, we have to get out by word of mouth. So thank you to everybody that's here today. This is really great information. And this is how we really reach out to everybody in our communities and what we do. So as you guys see here, we do have our mission and our vision. Really, in a nutshell, is we just want to support everybody in our communities, which is really servicing mainly the state of North Dakota. We do slide some Minnesota in there as well here and there, but really North Dakotans, we are here for you in every way that we can be. And we're going to take this time today to discuss that. I'm very informal when I do things. You guys will kind of hear me probably make some jokes here and there. We talk about a lot of tough topics. So if you guys do have any questions throughout, I am going to have a spot at the end for questioning, but if something is really pressing or it's on that slide, you're going to forget it, please feel free to raise your hand. Please grab a mic if you're in here, just because we want the online people to hear you too. And then I can answer it during it too. So whatever works best for everyone. So a little bit about us here. We believe in fighting the stigma of mental health and some of the issues that kind of arise around that, and then suicide prevention. So that's a lot of kind of the one side of things that we do. We do this by providing 24-hour access for help and hope through our 211 helpline. And as you guys have heard mentioned today, we also answer the National Suicide Prevention Lifeline. We also provide different trainings on suicide prevention, mental health. This can range from an hour to 2 full days. The 2-day one is that assist that we've heard before. And then we offer a lot of different trainings, and I'll get to that here in just a second. I like to jump ahead of myself. We also offer what's called a care and support program. So this is a really unique program for individuals who might be struggling with their mental health and or substance use, and we can really reach out to them and provide just that support of a caring friend. Sometimes it's a little bit harder to have that or have those conversations with family members or close friends. You're not really sure how it's going to go. So First Link provides that non-judgmental support. A little bit about us. So this is kind of a little bit of our timeline. I'm just going to point out just a couple of things here. So we are accredited by the American Association of Suicidology. That happened in 1987. 1998, that's when First Link formed and had changed our name to First Link. So some individuals might remember us from our other name, which is very long, Community Resources, Inc., to First Link. A little bit more of a timeline for you. So we again became accredited now by the Alliance of Information and Referral, also known as AIRS. In 2009, in 2012, we began that suicide follow-up program that I was telling you guys about. And then we also have our Community Navigator program, which kind of those two pair now to have our care and support team. So we are on phones quite a bit. Our 24-hour telephone services, who do we answer for? A lot. There's a lot of ways to get a hold of us. So we answer that 211 helpline, which we'll talk about here in just a second. We also answer for a lot of call forwarding agencies. So I know it was mentioned that we do answer for the NDUS colleges, counseling centers after hours. We also answer for the Rape and Abuse Crisis Center after hours. We answer for the Military Service Center after hours, Region 4, Human service centers, how could I forget? So we answer a lot of different phone lines after hours, which is really great because, again, we're kind of that link and that source for resources. We also answer the National Suicide Prevention Lifeline, and then we also offer our texting services. So pretty much anything you can do with the 211 helpline, so that could be listening and support, information referral, you can also do that via text. Our suicide support services include our care and support program, which I'll talk a little bit more in a second. Our suicide education outreach, which is a training that we do when we go into the school systems and we talk with 7th, 8th, and 9th graders. We talk openly and honestly about suicide. We talk about statistics, myths. We also provide the opportunity for them to anonymously ask questions, which I answer right there in that classroom. So that way students can get their questions answered. And sometimes if one student's thinking it, others might also have questions. And so it's just a really good way for us to have that open conversation. We also have our suicide prevention and mental health trainings. So our care and support program, individuals can be referred to us two ways. If they were recently discharged from a hospital or clinic for potentially a suicide attempt, suicidal ideation, they can get referred to us that way, in which case we'll follow up and just check in again, see how they're doing, ask if there's anything we can do to help. Since we do have a resource database, often we can provide them with resources that might be able to help them as they continue on their journey. Otherwise, if callers call in on any of the lines, NSPL or 211, we can also refer them that way. If we're talking with them and we notice that they don't necessarily feel like they have the support to kind of continue on and have those things, or don't feel comfortable maybe talking with their close ones just yet, we can provide this program where we can call them either weekly, bi-weekly, or monthly. Totally up to them, whatever day and time works best for them. And it is absolutely free. And they can stop at any time. So they can say, you know what, I'm doing really good. I don't think I need the calls anymore. And if they're in between calls with us, they can call us at any time too. So even if they're scheduled for bi-weekly calls and decide, hey, I had a really tough week this week, they're always encouraged to give us a call at any point in time too. So a little bit about our phone services, just because we do answer a lot of phones and it can get very confusing. Our 211 helpline is going to be, you can call us by either dialing 211 or the 701-235-7335. And if you are in the state of North Dakota or within Clay County, Minnesota, that's going to get routed to us at First Link. We'll talk about here in just a second how 211 is a nationwide service. Or you can text us at 898-211. And this resource, again, is a 211 helpline. So this is not considered a crisis line. And although all of our staff are trained in crisis intervention, so if we were needing to, we could obviously utilize that in the call, there can potentially be a wait time on the 211 because it is a helpline. It is not a designated crisis line. So we just try to tell people if you are in crisis, it is a really good idea to call the National Suicide Prevention Lifeline. Because again, you're still getting routed to us. We're still going to be taking care of you. But no call is going to go unanswered on the NSPL line, and it takes that priority because it is a designated crisis line. That being said, the 211 can potentially have a wait time, but usually we really pride ourselves on not having a long wait time. We know how difficult it can be already, sometimes making important calls like that, and so we try really hard to get to them as quick as possible. So our suicide prevention lifeline is going to be that 1-800-273-8255 or TALK. I know you've heard that a few times today, but I will continue to repeat it because it is very important. We focus on suicide intervention on that line. However, you can also call, like we stated earlier, for concern for another. You can also call if you have lost a loved one. So that line, I know a lot of people think, well, I don't know if I'm in necessarily a crisis state, but I'm just really dealing with something. I always tell people, just make the call. We're never going to be upset that you called because you're having a tough time, or, we're not going to say like, oh, one's higher than the other. If you're in need, call. And I think often people think, well, I don't know, maybe somebody out there needs it more than me. And I've gotten that quite a bit. And I always tell the person, if you went to a hospital right now, the doctors aren't saying, oh, somebody needs it more than you, go back home right now. No, they're saying, hey, you came here because you needed support. Right? You needed something, you needed to get better, we're going to help you. And that's going to be the same thing for the text line or for the National Suicide Prevention Lifeline. All of our phone lines are absolutely free, okay? So that's, again, why they're a really great resource. And we offer non-judgmental listening. So I know that our staff is trained really well, and we don't care who you are, what you look like, where you come from, how much money you make. At the end of the day, we just want to help you because you're a person who's needing help, and that's what we're here for. We're just really here to support you. So we are there 24/7. When I say 24/7, I mean it. You can call it 2 a.m., 2 p.m., 2 on your favorite holiday, and there's always going to be somebody there to answer for you. So we're going to go a little bit back into that helpline here. Again, it is free. And again, we do have texting too, and it's available 24 hours a day. There's no time limit on that. We do offer listening and support. So when I talk to pretty much anybody, I say, look, if you're having a really bad day and you just feel like I don't have anybody to talk to, and you can kind of feel like it's just building and it's a lot for you, give us a call. We can provide that emotional support. If you are in need of help for rent or utilities or needing food, we also have resources for that. So that is what that 211 helpline is designated for. We have a lot of nonprofits and government agencies in our database, and we're going to cover that here in just a second. And this is available to all of North Dakota and then Clay County, Minnesota, because you can't split up Fargo-Moorhead. So we have that one as well. Talking about that 211, like I stated, this is a national number. So if you are calling from a different state, but you're needing North Dakota, you're going to want to call that direct line, that 701-235-7335. But there is a 94.6% overall coverage for the 211 helpline. So even if you yourself know somebody in another state, a family member, a friend, and they're needing support, you can definitely tell them to call their local 211. And 211 is part of the N11 numbers. It's a lot of fun because often we can get calls where people think we're the 411, which is great. So if they call us and say, hey, what's, the Walmart in Bismarck's address? We don't have that in our database, but what I do have is the toll-free number to the 411, so you don't got to pay for it. So that's where we can kind of help out. We'd provide that free number. You can call the 411 and they'll be able to provide that for you. So for anybody who's not super familiar with the N11 numbers, probably the most popular is that 911. That's pretty familiar. We learned that at a young age. But some of these other ones, maybe we don't know as often. So we just kind of like to put that up there. Now jumping into the National Suicide Prevention Lifeline just a little bit. Again, that number is 1-800-273-8255. It will be changing to that 988 in July of this year. So again, just simple. For anybody who is, has a smartphone, I know that both Apple and Android have been working so that if you talk to Siri and say, hey, Siri, call the NSPL line, she can do that for you. So there's definitely improvements. It's slowly, but we're definitely working towards a lot of great improvements for everybody. But I definitely think the 988 is going to help a lot. Yeah. Oh, sorry. Yes, Mike, please.
Hello.
Oh, there we are.
Right spot. When that 288 goes live, does that mean that if I got my phone, I moved from South Carolina, where's Dennis? South Carolina, and came up to North Dakota, who would I get with the new number?
You can. Okay, I was like, I don't know if the online people can hear you, but yes, it's going to be routed by your area code. So
Okay,
if
so
you
where you're
move from,
located.
Yep, so your 701 cell phone number
Okay.
or landline, wherever you're calling from, that's where that's going to get routed to. But if you want to get, firstly, you can definitely get a 701 number. It's pretty cool.
Okay.
Good question.
So yeah, out of respect for the people online, they have no idea what's going on right now. We need to get a mic over there.
Sorry about that. I can't interrupt my boss, so.
Yeah. We all were like, I don't know. So if you have a 701 area code and you call the suicide lifeline, it would route to First Link and Fargo. Or if you're in 19 counties in Minnesota with 218, it would go to First Link and Fargo. So if I'm like, I have a 701 area code on my cell phone. If I move out to Colorado and I call, I'll still get Fargo and I'll still get First Link because I have a 701 area code.
So that's not going to help when, okay, had a bad situation there. Okay.
So yes, there's definitely still some struggles with that, but we're trying to work on it. But they also will still get connected with the National Suicide Prevention Lifeline. So that was a really good question. Yes, thank you. So again, you can call the Lifeline, whether it be you yourself are having thoughts of suicide or just struggling. If you have a concern for another, one thing that I do like to mention in that concern for another, and I think Dennis kind of talked a little bit about his and how he kind of broke the rules at that time. So that was great breaking the rules there. We actually offer what's called a third-party call now. So if somebody calls us, I know I see the shock. If somebody calls us and says, hey, I'm really concerned about my friend, kind of gives us some information thinking, hey, I don't know what to do, we offer a third-party call. So what we'll do is we will call that person, we'll get their name and their phone number, and we will call that person and just let them know like, hey, my name is Kesha, I'm calling from the Suicide Prevention Lifeline. Somebody in the community is worried about you. We never tell them who because it's anonymous, okay? And we just say somebody in the community is, concerned about you. Do you have a couple minutes to talk or would you like to talk with me? It's totally up to them. They can definitely hang up on me or not talk or not answer. If they don't answer, we're not leaving a voicemail or anything like that, but we will call the friend back and let them know like, hey, so sorry, we weren't able to get a hold of John Smith today. Here are some other options. We can always tell them you guys can call together, things like that. If we are able to get a hold of them, we will try to talk with them and kind of decide where they're at and what we can do to support them and help them in any way possible. So that is something that we do now. But yes, and I always tell people, if you're not sure if you should call, always call. Nobody's ever going to get in trouble for calling us. And it's always better to have called and know what it's like and than to never call at all. And for this, we also service all of North Dakota, and then we service 19 counties in Minnesota. So it's about like the northwestern area. So I was talking about our database a little bit, and we have almost 6,000 resources of nonprofits and government agencies in our database. We work really, really hard, and we update that yearly. So every single agency gets updated annually in our system, and our database team is absolutely fantastic. It can get updated more, so if hours change or a COVID restriction comes up or something like that, we can update it earlier. It's just at minimum, everybody's updated yearly. And what we're going to do right now is just kind of talk about that, because as I was telling some of the people that came to my booth, I was like, I'm about to speak, so I don't want to give away too much. It's great that people are able to recognize that, hey, I need assistance, whether it be for rent, whether it be for mental health or anything else. Sometimes the hardest part is knowing where to go next, right? Sometimes it's really hard to say, well, I don't have insurance or I don't have enough money to cover ABC, things like that. So that's where I'm always giving a shout out to First Link and saying, hey, we can help you out. We can find some different resources and try to come up with a plan that can help you in any way that we can. So that database has a ton of different resources, and often people will call about some of the things listed here and then some. These are just some of the more common things. So I'm going to touch base on just a couple. So like basic needs, emergency shelters, financial assistance, food assistance, military support, substance use, suicide support groups, and more and more and more. So I always say, if you're not sure if we have a resource for it, give us a call. Sometimes even I'm still surprised because, like I said, I can't memorize all the resources. There are a lot of different resources in the area, and sometimes it's just we don't quite know about them as much. When people call, we have two different things which we call our needs and our unmet needs, and they can get a little confusing. So needs are when somebody calls and says, hey, I need assistance with rent, right? They know exactly what they're needing. We can find that for them. Cool. Looking at 2021, some of our top needs of our callers that called our call center were rent, electric, and food. Okay. keep those in our pocket. We're going to move into the unmet needs. So unmet needs are a little confusing. So an unmet need is when somebody calls, maybe needing, for example, rent, but is either ineligible for the resources we have, declines a resource we have, or we don't have a resource available for that person. That's what we call an unmet need. And we mark this because we want to know if our callers are calling us and they're not having needs met, this is the way that we can say, hey, organizations, this is what's going on. Maybe we can look at putting a new program in here, especially if we see a lot of this. When we look at our unmet needs of 2021, it's going to be rent, gas money, and electric. So as you can see, it's very similar for the needs and unmet needs. And so sometimes, you know, we might have the resources, but you know, they could have used them all or be ineligible, things like that. So that's kind of how we display those. We also, during a disaster, FirstLink coordinates a lot of things, so we kind of wear a lot of different hats. So if you look up here, we can, you know, work with local cities and county volunteers. We can definitely serve as like the check-in sites for volunteers and different things like that. So anybody that was in Fargo-Moorhead around the flood time, FirstLink did a lot of stuff for that. We also work with the Child Abduction Response Team or the CART tip line. So we do a lot of other things too, just because we're really well set up to do those types of things. So looking at some statistics just for FirstLink, on that top left-hand side, that's going to be our data dashboard. So if you go to our FirstLink homepage, which is that bottom snippet, you'll see it on there. We actually created a dashboard that updates in live time and can provide you with a lot of statistics. So I know that this screenshot's a little bit old, so I got to update it, but I just pulled up our data dashboard at our booth, and we have almost 7,000 calls already for just January of this year. So we're definitely doing well. But if you're wanting to know either for your agency or for your city, if you want to look up crisis type, anybody who really likes numbers, this thing's amazing, definitely for you. So I did a little bit of numbers here. And in 2021, we took 83,977 calls. This went up from 71,000 in 2020, and that went up from 60,000 in 2019. So we're definitely seeing the jump, which is great because it means people are knowing that we're here for them and are able to reach out to us. So we really like that we're seeing increases. Our total resources given were 28,000. Again, that jumped from 26,000 in 2020. Calls related directly to suicide, we took 15,491. This jumped from about 12,000 in 2020. So we did see a slight increase there. But one thing that I really like to highlight is this next number. So of all those suicide calls, we only had to contact dispatch or law enforcement 91 times. So what this number tells me is that our staff works really, really hard on our crisis intervention. And sometimes we really have to just assess where the person is at. Obviously, if a person has already done something to harm themselves or somebody else, we're going to have to call dispatch. But we really try really hard to work with our callers to find either treatment or like safety plans that we can put together that work for them too. Often when I go into the schools, some of the reoccurring questions I get are, if I call you, are you automatically calling my parents? Or are you automatically calling the ambulance on me? And so again, we just really like to assess the situation, and we try to work really hard with the people to find what works best for them. So looking at some of this is just now a pie chart of really what we do. Information and referral are split, and that's because information is going to be to reference who, if somebody already knows the resource that they're needing, and we're just providing like a phone number or hours of operation. A referral is when somebody calls and says, hey, I really need help with rent and I don't even know where to start, you know, what's out there. That's going to be a referral. Then we offer listening and support and our crisis intervention. So finding resources with FirstLink. Like I stated, we do have our database online. So everything that we can see as call specialists, everybody in the public can see as well. I've talked with a lot of different like counselors or social workers, and they say that they love to pull this up because they can just work with their clients right there. And they also provide that ability to kind of show their clients how to utilize this too. And then often they say, you know, if we just don't even know where to start, we'll give you guys a call. So, which is great. We love both. But we do put this on our website, and I like to notate that because sometimes you're just not in the ability where you can call or text at that time. So if you have access to the internet, this can be very helpful. You can do that by going to www.myfirstlink.org, and that's going to have that main screenshot, like I said, again, with our dashboard, our directory, and if you need to get help, we put that right on front and center too, and that's going to provide the numbers that you can reach us at. So if you were going to find a resource on here, what you're going to do is you're going to want to make sure that you are typing in your area and try to wait. So like for Fargo, I want to wait for Cass County to pop up because otherwise I might accidentally hit the Georgia one. And although that's great, we do not have resources for Georgia, so nothing's going to pull up and it might get a little wonky. So try to wait for that county to pull up no matter where you're searching, what area you're searching for. We also have the ability where you can just type in your search. So if you know exactly what you're wanting to look for, whether it be rent, I use rent a lot because it's a very common one and it's easy to go to. So you can also type that in as well. One thing that I like to say is make sure that you are searching for the services and not necessarily the group that you're trying to help. So down here I have like, don't type in veteran. If you're looking for a veteran assistance, make sure you're typing in directly whatever assistance you're looking for. So finding resources, one of the things that we did on our directory is that we wanted to make it easier to find some of the more common things that people search for. So we created this little page so that way when you click on it, you can kind of drop down into what you need. Again, just make sure that you're putting your location. If you don't put a location, it's just going to pull up everything in our directory. And so you might get a lot of resources. And if you're in Minot, only getting resources for Fargo, that's probably not going to be super helpful unless you're really willing to make that drive or know somebody that lives there. So this is just a little bit more in depth. So when you click one of those drop downs like I did here, so I clicked the food, it brings down another drop down. There's options to choose from. And then you can actually drop down again to get even more specifics. So we did do that as well. When you are looking to find resources, on the initial search page, it's going to give you the program name, a short description of what they do, city and state that it's located in, and phone number if they have it available. So it's going to look something kind of like this. So I just took a quick little screenshot. It's going to start with number 1 through however many resources it can pull up, and it's going to start closest to you and then start working further away. So when you are finding the resource, this is kind of what it's going to look like on the top half of the screen. So again, you can see my search. One thing that I like to show is that we do have a lot of different filters. So if you're wanting to know if there's COVID restriction, if you don't have insurance and you're wanting to find out what places will accept you without insurance or different types of insurance, you can also do that as well. And then when the searches pull up, there's also going to be a little map just to show you kind of directionally where everything will be located. So when you click on a resource, like I did on here, I basically just clicked on one of those. This is what's going to pull up. It's going to pull up all of their information. So it's going to give anything that the agency is willing to give to us. So address, phone number, how to reach somebody, who to reach, hours of operation, eligibility requirements. I mean, as much as we can possibly get information to help make these situations easier for people, that's really what we try to do. Sometimes agencies don't want us to provide like a direct phone number to somebody, they just have a general phone number. That's a-okay too. So you might find little differences like that, but that's kind of what's going to pop up. If we have an application process, we'll list that as well. So again, here are just some of the most common searches in a different format. So rent, electric, gas money, food pantries, clothing vouchers. Around the holidays, we'll find different agencies will host specific programs. So we will have that listed as well, and it'll be on a seasonal program. And then also general counseling and services that are available. Again, we offer a lot of different trainings. So I know a lot of people have talked about different trainings today, but we do offer what's called LivingWorks Start, Safe Talk, and Assist. We're also trained in mental health first aid, and youth mental health first aid. FirstLink also offers a ton of different in-house trainings that we do. So suicide risk assessment is one that we do often. Like I said, the suicide education outreach, mental health awareness, and different trainings like that. So if you're ever interested in a training or interested in learning more about trainings, you can definitely visit our website or just scan the QR code up here. And if you have any questions or want to know more, I do have my business card over there, which has the email address you can reach out to about training interests and things like that. I have, a little bit about our social networking here. We recently joined TikTok for the Giving Hearts Day challenge. That was super fun. But we are active on a lot of our different social medias. So we'll post about trainings. We'll post about different agencies and kind of spotlight agencies across the state. We'll talk about FirstLink and kind of what we're up to and what's going on. So it's just a great way to kind of find out if you're into social media and just kind of wanting to know what we're up to. I always put the slide link up with FirstLink. So here again are the different phone numbers and the ways that you can reach out to us. So the 211 helpline, which is a helpline, and then the National Suicide Prevention Lifeline, which is a designated crisis line. You can also visit our website. We have a ton of different things on there. All of the blue folders that were spread out across the tables are your guys' to take home. There is one survey in there, I think has been mentioned a few times. If you wouldn't mind filling out that survey, and then you can either hand that to myself or Jennifer Illick, who is at that front table. We will definitely take those. So we really appreciate you guys doing this. I know surveys so fun, but it really, really helps us because we want to know what are the people wanting, what can we do better, and how can we just really help our communities. So you can just definitely turn those in, please, before you leave, and we will appreciate that. I do want to give a shout out at the bottom of the screen here. You will see some different organizations. We are a nonprofit, so it's great that they are able to help us out a lot. And there's many, many more. I could probably go on. So we're just very thankful for everybody that helps us out and contributes to FirstLink. With that, I talked really fast, and this whole presentation was really about a lot of training opportunities and who FirstLink is and what we do. Does anybody have any questions about FirstLink, mental health, suicide, anything that you're wanting to ask? If you do want to ask, please raise your hand so that we can get you a microphone, or if you're online too, you can ask questions through the chat.
Can you hear me?
Yep.
This is Sarah, where I'm relaying some questions from online. We had a question regarding is 211 anonymous?
Oh, that's a really good question. So we take our confidentiality really seriously. We only know the information that you're going to tell us. So I usually do, I'm going to be honest, I will ask, I'll be like, hey, my name's Kesha, what's yours? You don't have to tell me. I'm not going to hound you down for it. But sometimes it's just nice when you're making that connection to kind of know how to address the other person. But it's definitely all optional. So no, it can be anonymous if you would like.
We had a lot of questions, excuse me, about making referrals to the support and care program.
Okay.
They're wondering how organizations can make referrals to this support and care program.
Yeah, so our care and support program, we work with a lot of different clinics and hospitals. Again, we can also refer in-house. So if either if they're asking for themselves or for somebody else that they know, they can always give FirstLink a call and we can talk with them. And if that's something they're interested in, they can talk to us about it. But we can also provide other resources depending on what the person's needs are. So kind of two different ways.
So would you recommend they call 211 or the FirstLink administrative line for those questions?
Yeah, I would recommend calling 211.
Okay.
Do you have anything you'd like to add, Jennifer? Okay.
We have a lot of calls come into our agency from people that are in the area but don't have a 701 number. Do you have a suggestion for resources to direct them to?
Yeah, so if they are able to go somewhere with the internet, I know a lot of libraries provide free internet. Again, they can go to our directory. So that is available online at www.myfirstlink.org. So if that is an option. Otherwise, they can call the 211 directly at that 701-235-7335. I think. It's a lot of phone numbers to memorize.
We had a question regarding the unmet needs, wondering if you have any insight as to whether unmet needs could be, I'll just read the question. I'm just thinking the reason for the unmet need is due to no income, as most grants require income.
Okay, so yes, so for that question, and I'll actually just go back on my slides here. So on this slide here, and can they see this online still? Okay, just want to make sure, because that would not be helpful. So on, whoop, did I go back one, two? Sorry, this slide here. That top one, so where it lists different information, there are a lot of organizations that if you are low income or currently have no income for whatever reason it might be, we do have a lot of resources that help individuals in that, that are dealing with that. So there are even different healthcare things that we can do. And that's again why it's so important with the filters. And even though we have the filters online, we do that in-house too. So if a person states that they are low income and needing help with something, we can look for resources that meet their needs.
We had a question as to whether or how somebody could get any 211 cards to pass out at schools or local businesses.
Yeah, that's a really great question. So on our website at www.myfirstlink.org, when you go on there, on the left-hand drop-down menu, there is a resources tab. When you click on that, it has a printable resources. So when you do that, we actually have the ability, all of our promotional material, everything that we have, we put online. So you can print them in-house if you would like, or you can order them as well if you want them to look more professional too. So we have both of those options, but all of those things are listed as well online if you would like as well. So hopefully that answered that.
Are there resources listed specific for the reservations?
So I know we do have some resources in our database as far as listed like distinction. There's no specific category on the drop down. But if you're looking for a resource and you do it by wherever you're living, it's going to pull up the resources that are closest to you.
So many good questions online.
Oh, I know. It's fantastic.
How do agencies get listed into the database and how often does it get updated?
That's fantastic. So the database gets updated, every agency gets updated yearly at minimum, sometimes more. If somebody feels like they're not in our database, we always say reach out to our database team. You can either give us a call on the 211, we can get you connected, or our admin office, Call our admin office and we will get you connected to the database team. And they can either send you a form through email, mail. They have a lot of different ways that they can send that. And if you are wanting to get added, if you're not in there, we can definitely work towards that as well. So we'll answer a lot of questions. The database team, fantastic. And we're always wanting to add more too. So anytime we go anywhere, I'm always running around booths trying to get more information. So if we don't have you, we're always trying to add more.
So this question actually, there might be some other people here who would like to answer. Has FirstLink or other organizations ever gone to high schools to talk to kids about mental health, coping skills, suicide, etc.?
Yeah, so I'll answer first, and then if other organizations also want to answer, they can just raise their hand for that microphone. But I can get started talking while the microphone's coming to you. So FirstLink does. We do our suicide education outreach. So we talk about suicide statistics. We talk a little bit about some mental health. We talk about myths for suicide because we obviously want to, end that stigma. We provide the opportunity for students to anonymously ask questions about mental health, suicide, FirstLink, and we answer them in-house that class period as well. So we do go to different schools and do things like that. We also go to schools and talk either during the lunch periods or if specific teachers ask us, and we can talk about FirstLink too. And with that, we talk about mental health and resources. So, but if there's any other organizations that want to talk about what they do, I think that's great too. I know AFSP up here, Sam with AFSP, will be able to talk too.
Hi, I've gone into one school and talked about my journey with mental illness and some suicide prevention and stuff, and willing to do more schools if anybody's interested.
How would they contact you?
They can just get a hold of me here today. I can stick around for a while.
Can you state your name, please?
Chaz Brobst.
Thank you.
Hi, everyone, online and in person. I'm Sam from the American Foundation for Suicide Prevention. We also have programs for schools. The program that might be helpful, 14 to 18-year-olds. It's real. It's a program that we can go inside the classrooms. We want small classroom settings, but this is a free program to districts. We focus on mental health and how to notice the warning signs and how to have strong conversations, because even though that's scary, we can do that. So lots of resources available, either virtual or in person. afsp.org/North Dakota. Again, afsp.org/North Dakota. Thank you for letting me add that. Thank you so much.
Any other? Oh, yep, over here.
I'm not sure the name of it, but I think the schools now have a program. Do you guys, I think they purchased it and it's free to teachers. Anybody know what that is? It's newer since all of this wonderful COVID, but there is some program that they have too. But I want to mention the other thing that when I've talked to schools, or when schools are, they've had some suicide in their small areas or whatever, even their big areas, we've asked them to set up a phone line in the rooms and have them call First Link, so people know not to be scared to call First Link. They know what to expect, what they're going to be asked, that kind of thing. And so, there's been schools that have done that. You guys probably don't even know it, but, so that is one way to kind of ease that transition, especially if you've got a couple in your class you're not sure about, but that's quick and easy.
Yeah, no, that's a really good point. We do that in schools, time permitting, depending on questions and things. But I think too, it is really important that students or anybody really knows. No matter how old you are, I think sometimes it can be scary not knowing how that's going to go. One of the things that First Link is really good about is we're really open. We're open with, hey, this is how I would start that conversation. This might be how I would talk to you. And I think it also helps too, like when I tell people, like I answer the National Suicide Prevention Lifeline. Yes, I get to go and do trainings and all these other things, but I still answer the Lifeline and have phone shifts. So working on phones is also something I do. So I think that surprises people sometimes too, because they don't always put like 2 and 2 together. And so it's nice just to connect that a real person is on that other end and who understands, there's a lot of snow in North Dakota.
We have a question regarding the hotline. Does the suicide hotline document its phone calls somewhere like in a chart? Are the calls documented, in some way?
Yeah, so brief demographic information. Obviously, knowing that our callers are calling from North Dakota is helpful, but not, again, it's going to be that anonymous until you make it not anonymous. So if you want to tell me your name or you want to make up a name, either one works, whatever you feel more comfortable with. And again, same thing, what information you want to tell me. I'm never going to push a caller. Sometimes silence is golden, and I will just let them talk about what they need to talk about. So yeah, you guys have a lot of really good information or questions, and I'm really glad I left time.
If you call law enforcement to intervene, do you tell the caller that that law enforcement has been contacted?
So yes, because our first goal is to try and get the caller to work with us to call law enforcement. because it's always better when the caller is on the same page with us. Now, there might be circumstances, and again, this is going to be those extreme cases where they've already done something to hurt themselves or somebody else, and it's emergency needed. I'm still going to ask because I want that caller to be aware, and I think as people too, it's nice knowing that you're respected in that sense. But if the caller states no, I don't want law enforcement called even though I'm already in danger, sometimes we might have to break that and say, well, we're going to have to try and contact law enforcement because your life matters and we want to try and get you assistance.
I just have a quick question. Have you heard from people that, when you talk to them about, can I call somebody to transport you, that kind of thing? Have you heard people saying, am I going to get in trouble?
So yes, I think that's a fear, especially depending on age, things like that. It's always that I don't want to get in trouble because nobody likes to get in trouble. But I always tell people, at the end of the day, I'm worried about you and I'm worried about your safety. And I'm really open and honest with them. I think that's the biggest part, is being really transparent with our callers and just letting them know that, hey, at the end of the day, we just want to get you assistance. And, I can't personally say, are your parents going to get mad? I don't know. I don't know your parents. But what I'll tell them is that, our main goal right now is to keep you safe. Yeah. And keeping you safe involves calling law enforcement right now, then that's the option we're probably going to have to take. And we'll work through, if you want me to stay on the phone, we can three-way call your parents. Yeah. We've done that before where we've called the parents and said, hey, we want to have a serious conversation. Sometimes it's easier just having that anonymous person.
Well, and this was an adult, and that's why it kind of surprised me. But then I mentioned that to somebody, they said, yeah, I've heard that too. And I'm like, I didn't understand that.
Yeah. Oh, yes. Yeah, so sometimes, thank you, Jennifer. She mentioned mobile crisis units. So the human service centers have mobile crisis units that can actually go out to the person. So sometimes if it's not necessarily where they've already injured themselves, but are just at a high risk and really need somebody out there with them, especially a trained mental health professional, our mobile crisis units are absolutely fantastic. And since we answer for the after hours for the human service centers, we have those connections, so we can actually do that with a caller too. So that's another really great resource. Thank you, Jennifer, for mentioning that. I think I saw another hand somewhere. Yes.
Yeah, I actually have two questions. One is about the 211 for the Human Service Center, because as a person on call, I usually have to assist law enforcement in situations. So I guess I'm just wondering what that looks like for the officer, if they have to be there until they make contact with 211, or even if they're in my office and they need extra assistance. I guess, how would you want to deal with that response?
Yeah, so it's going to depend. Really, our main goal is connecting the caller with the Human Service Center, whoever the on-call is, or mobile crisis unit. That's what our main goal is. If law enforcement does have to be called out, so like if we call law enforcement and they're saying, hey, we want Human Service Center on-call to come to, then we would get the information from the police officer and then contact the on-call, letting them know, like, hey, mobile crisis was, they're wanting you, law enforcement, here's the information that they provided. But as far as like how long they stay out there, things like that, we don't really have any say. We're just kind of that connecting source, linking people together and making those different calls. So does that help answer?
Yep, definitely.
Okay.
And the other one is, if you're looking for resources, because I know there's a long list for mental health appointments for first-time intervention, and a lot of times they have different insurances. So would you want the provider to plug in the information, or it doesn't really matter where it comes from? So like if I'm with a client and their family and they have a certain insurance, do I plug that in as a provider, or do I have the families do that information?
That's completely up to whatever the family and or you kind of decide is the most comfortable. If you're looking it up online, you guys can do whatever works best. If you want to give us a call, then we would just, if that's a factor where they're like, hey, I have this insurance and I only want to go places that have this, you can just let us know and we will filter that in our system and then provide the resources that are available. So whatever works best for you guys.
Okay, thank you.
Yeah, good questions. Thank you.
Hey, we've had a couple law enforcement calls over the years where the men have been the ones getting beat up kind of in a domestic. And there's no crisis centers for men. Is that something they're working on?
I'm sorry, you said there's no
Crisis centers for them to go to be safe?
So depending on like your area, where would that be that you're referencing?
Yeah, Mercer County.
Mercer County?
Yeah.
Okay. So depending on what it is that they're kind of looking for, we can definitely look into different resources. I'm going to be honest, I don't know exactly off the top of my head. I know like in Fargo-Moorhead, we have the Rape and Abuse Crisis Center, which is open to anybody. But if they are experiencing anything like that, they can definitely give us a call. As far as being worked on for agencies, I'm not aware of any currently that I can think of, but again, we might have some in our database. 6,000 resources is kind of a lot to remember, so there is potential there's something nearby, but that's a really good question, so thank you. Yeah, and I think it's good that you're already recognizing that, hey, this is maybe something we need in our area, and to recognize that. And what I would also recommend is have people call 211, because if there is a resource, we can give it to them, and if not, it goes documented in that unmet need, and if we're seeing an increase in that, then we can also show the data that, hey, look at this amount of callers from this area, this is something we need to look into. So we always say, give us a call. Thank you. Yes.
I have a couple questions yet. I had it asked to me a couple days ago about the law in North Dakota, and is it illegal to attempt suicide?
I'm not aware of any law. I think at the end of the day, and I'm going to speak from any law enforcement that I've personally spoken to, so I can't speak for all law enforcement. So if anybody in here has anything on that, please speak up. But I will say every officer that I've talked to regarding mental health, because I go a lot of different places, they've always told me that at the end of the day, the safety of the person is what's always most important to them. So even for students, I know a question that they ask a lot is like, what if I'm at a party and something happens and do I call? And I always say, yes, call, because if somebody's life is at risk, no matter why that might be, we're always going to need to take care of that person, right? And that's going to be the main focus for law enforcement. That is their main goal, is to make sure that whoever's at danger is safe. So I would say that. If anybody has anything else that wants to speak on legality? Nope, not seeing anyone? Okay. Hope that helped. Sorry.
No, it did. So I'm going to play devil's advocate for a second.
Okay.
I know that there's some conversation about assisted suicide in the medical field, and as Cora talked earlier, you know, that she kind of saw her son declining for months, and then kind of, you know, you prayed and said, you know, take him.
I prayed to God to take him.
You know, just because he had been declining for so much and stuff. And at what point, and she said that your son just said that it physically hurt. At what point do you say to somebody that is suffering that deep into depression, because I had suffered for 20 years. At this point, I'm glad that none of my suicide attempts took. I'm glad to be here today, but in those depths, I wanted to go.
Yeah. Thank you so much for being open about your story. I think,
you know,
that's
so,
really brave. Go ahead.
Sorry. Assisted suicide in our state is not.
Yeah, not in our
legal.
state.
No, so.
Right.
Yeah.
But, yeah, I mean, at what point do you say you make that choice that's best for you?
You know, suicide is unfortunate, and you know, we think it's all preventable, so we would do everything we can to make sure you know and get you hope. So, you know, we would try to get you that help. So, and I hope, I think maybe something worked, right?
It did. And like I
Okay.
said, I'm glad I'm here and I want to prevent suicide and
Yep.
I want to get to that 0,
Yep.
you know,
Yep.
Which
So-
but you know, there's people out there that,
Yes.
you know, that
You're
are
absolutely
hurting.
right. Have you taken ever any, like, so I'm just going to throw it here because I do have this up. So ASSIST that applied suicide skills intervention training.
I've done the Safe Talk. I have not done the Assist yet.
I would highly recommend the ASSIST because there's actually a section that kind of goes through a little bit about this.
Okay.
I'm personally not going to speak on it because it's not my place right now to say yes, no. As we stated, it is not legal in this state. And so that's kind of where I'll just leave that one. But
Okay.
if you want to talk, we can definitely, I'll tell you a little bit more about the training because it is fantastic and it does touch on that in a section. So that's a really, you know.
I do want to do the Assist.
Yeah, that's great. That's absolutely fantastic. I'm glad you've, you know, been able to take so much and learn so much. And thank you for sharing everything.
I'm going to just let you know we have about 4 minutes left. Lots of really awesome questions. So yes, thank you for saving some time. A question from online is, do you have or receive military-specific training or resources available listed for active duty personnel and families?
Before you answer that question, I want to touch base on your comment about the legality of that. I actually work in crisis level intervention social worker at our hospital. If we have somebody that comes in and we have any allegation of someone encouraging suicidal behavior, including the act of do what's best for you, we actually mandate report that to Child Protection Services for all children. That is considered illegal to encourage or even offer that level of interaction. So when it comes to an adult level, at the hospital level, it's a gray area on whether or not we encourage police involvement because it is, whether it's a continuity of care or not, but we take great regard into those comments on even the people that we have the best interest in mind. Those comments are very critical at our hospital level.
Thank you. Thank you for sharing that. I appreciate it. Going back to the online question, so as far as I believe is for active military, correct? That's what they stated?
Do you receive any military-specific training? And then also, do you have resources for active military?
So we, like military specific, some we do, yes, but then again, like all of our resources might also apply depending on eligibility for them. So we do have resources. We always encourage them to reach out. What was the other part on there? Yes. Thank you. I was like, what was the second part of the question? I already forgot. But yes, we do have 4 hours of designated training related to military personnel. And then even like for training for me, like we recently had an individual take our ASSIST class who actually oversees the Navy cadets for a specific region. And he actually asked us to come out and do a training for them. So even on there too, like we included a lot of different like military information, but then we also talked about just like First Link and other things too. So we do work as best we can and try to, any way that we can, help ourselves to be able to assist really anybody who calls us at the end of the day. That's what all of our training goes through because anybody can call. We want to be able to help everyone. Yes, and we do work very closely with the ND Cares, yes. And would you like to speak at all? Okay, perfect.
Yes, we do provide military culture training to any organization that asks. And so we can definitely do that. And also for resources for active duty, of course, we always say, go to your chain of command, go to your chaplains, go to your mental health providers that are either on base and even in the Guard. You can definitely do that as well. So there are resources out there. And of course, the VA is always a wealth of information for any type of resources a veteran needs.
One last thing before I'm kind of wrapping it up here. Thank everybody for their questions. Again, if you fill out the surveys, please hand them in to Jennifer or I. And then Jennifer and I both do have our cards here too as well. So if you're wanting to find out more information, anything about trainings, or if you just want to come talk to us afterwards, we love having conversations with everybody, anybody. So please feel free to come up and talk to us too afterwards. Thank you guys so much for having us here today and everything. And thank you so much for all of the amazing questions.